is because earlier this summer, the Maine legislature voted to incorporate paid family and medical leave legislation into the state budget, which Governor Mills signed and is now enacted into law. Maine is now the 13th state plus the District of Columbia to offer comprehensive paid family and medical leave. And today we're going to explore what this is going to mean for workers, the history of efforts to enact paid leave here in Maine, what it takes to support and pass good public policy, which is not easy, and next steps in rolling out the paid leave program in Maine. We have two terrific speakers today. Joining us to talk about all of this are Destie, Hohman, Sprague, and James Myall. Destie is the executive director of the Maine Women's Lobby. The Maine Women's Lobby works to build gender justice in Maine through legislative advocacy and systems change. They do this by providing direct legislative advocacy and policy analysis, and by building and supporting a gender-responsive legislature. Their vision is a gender-just world, one where all people have dignity, equity, justice, and autonomy, and where they are free from sexism, misogyny, and all oppressions. Destie joined the Maine Women's Lobby team in 2020 after 11 years with the Maine Coalition Against Sexual Assault. Destie is passionate about organizational infrastructure, policies, and practices which reflect anti-oppression and feminist values. She believes Maine should be a place where all people can live free from misogyny and gender-based discrimination. Welcome, Destie. And James Myall is an economic policy analyst here at the Maine Center for Economic Policy. Through policy research, issue framing, and legislative advocacy, MECEP develops and advances policy solutions that support economic security, shared prosperity, thriving communities, and a fair budget and tax system to secure improved economic opportunity for Mainers throughout their lives. James is MECEP's lead on building a just and inclusive economy, including research on labor issues, gender and racial equity, and healthcare policy. James conducts research and impact analysis, writes educational materials, and collaborates with partners frequently. He is skilled at data collection, research, and statistical and policy analysis, and is the author of our signature annual report, The State of Working Maine, which he's hard at work on this summer. So just a note of housekeeping, please drop any questions you have in the chat along the way. We will definitely leave time to take them at the end. So let's go ahead and dive in. And again, thank you all so much for joining us. Paid family medical leave offers substantial benefits to individuals, businesses, and the economy as a whole, and is a critical tool for addressing Maine's workforce shortages. Working families need both flexibility and financial security. Workers may struggle both with the cost of caring for their loved ones, but also managing their own economic and job stability when they need to provide that care themselves. So paid family medical leave will offer that financial security and the reassurance that workers won't have to choose between health and a paycheck. So let's start by talking about how Mainers are impacted by this new law. I'm going to go to James first.
Yeah, thanks, Megan. And it's really great to be here. It's especially fun, I think, to be in a webinar talking about how we have passed the policy and how it's going to come into effect. So after a lot of work. Yeah, so one thing we know is that, right now, only about 28% of Maine workers have access to a comprehensive paid family and medical leave program through their employers. And we also know that even the state and federal laws that govern unpaid leave are inadequate. Only about half of all workers are eligible even for the unpaid family and medical leave programs. So we know that there have been some huge gaps, which leave a lot of people unable to care for themselves or a family member when the need arises. When the new law is fully implemented by 2026, by contrast, we know that nearly all Maine workers are going to have access to this. It'll cover about 600,000 workers and their families. That's about 90% of the workers in Maine. And it does it. The remaining people who are excluded are a small number of folks who tend to be temporary workers, who don't meet the earnings threshold, and some folks who are self-employed workers who may opt out. People on more generous private plans that can still keep that private plan and be covered. But the hope and the aim is that we will end up with a system that means that nearly all workers in Maine will be able to access this program and won't have to choose between care and a paycheck.
Thank you, James. Destie, can you talk a little bit about who is currently impacted by the lack of paid leave?
Sure. Well, first, thanks for having me. And thanks for all of our good work together. James and MESEP and Maine Women's Lobby, but the whole coalition really pulled together to pass this. And so I agree, it's thrilling to get to like debrief what happened and what happens next. When I think about who's impacted, we go back to the purposes in the law, like for what reason do you get to take paid leave? And that is for caring for the birth or placement of a new baby, caring for yourself after serious injury or illness, or caring for a loved one after serious injury or illness. Also, a few additional pieces around military deployment or safe leave after sexual or domestic violence. But when we think about those pieces, we're really talking about literally everyone. So no one goes through life without needing to care for themselves or a loved one or a baby at some point. And so everyone's impacted. But then when I think about who really bears the brunt of not having systems like this, for us at the Maine Women's Lobby, it's a gender equity issue, because the people who are primarily providing care in our communities, the kind of care that is not paid for, is typically women. Women provide about 85% of the unpaid care in our communities, whether that's caring for new babies or caring for neighbors. I myself have had a baby, have had a sick partner, have been sick myself, we help a neighbor as they're experiencing Alzheimer's. So it really, the brunt of lack of systems is falling disproportionately on women, who are then and people of color and low wage workers, but who then are giving up pay or changing their career plans or working part-time or taking breaks from employment altogether. And all of that not only affects their income in the moment, but over the lifetime as those retirement benefits accrue and as you move towards Social Security. It makes a huge impact to have taken time away from work in order to provide that care labor. So everyone is impacted. Women, people of color, and low wage workers really bear the harm.
James, do you want to expand a little more there?
Yeah, I mean, I think that's really true, and I think that's one of the great things about like working on this policy has been we've been able to say it really is an issue that affects so many people. We know it has these disproportionate impacts on low wage folks, on the women who end up carrying most of the care burden. We also know that when MESEP has done research and surveys show this nationally as well, that people of color have less access to any kind of leave in the first place, and they're often more likely to be in those lower income jobs that make it even harder for them to have any savings to take unpaid leave. We also know that there's a disparity that's particularly relevant for Maine in terms of rural workers being less likely to have access to paid leave. Often if you live in a rural part of the state, you have to travel further to be able to seek care at a hospital, less access to childcare, that sort of thing as well. So I think there are a lot of good reasons to support kind of marginalized populations through passing a policy like this as well. We also know that rural communities and rural parts of Maine have higher shares of older residents that often have higher care needs. And from a recent MESEP report, we know that family caregivers provide an estimated 155 million hours of unpaid care each year in Maine, worth about $3 billion. So right now there's a huge amount of care needs that are being met on the back of unpaid work, primarily being conducted by women. In a way that this paid family medical leave program will reduce some of that burden as well.
Yeah, it's clear that this policy will address a lot of the disparities we see, and you talked a little bit about how workers in low income jobs may not generally have this benefit, and there may be larger businesses that are already offering this benefit. Can you, James, talk a little bit about the benefit to businesses in addition to the benefit to workers, and maybe how that might affect small businesses in particular?
Yeah, and that's one of the things we've been really trying to spread the message about, because I think there's been some opposition from some business lobbying groups, and I think some sort of misinformation out there, or just fear among businesses But I think what we've seen, and it's great to have a policy like this that's been tried and tested in a number of different states. What we've seen in those states is that allowing employees to take paid leave, it reduces turnover and reduces the chances that employees are just going to quit their jobs entirely, which we see all too often. But it also improves productivity and morale. It helps to keep workers attached to their jobs, and so pays off in that sense for businesses. And then for small businesses, a statewide program like this, I think is really helpful in allowing them to offer something. I think what we've heard from a fair number of small businesses in the state is that they would like to be able to have a paid family medical leave program, but sort of purchasing a policy through a traditional insurance program is too expensive for them. And having a statewide program like this kind of spreads the risk and lowers the cost to employers and employees by making sure that everyone's covered and that everyone's paying into the program.
Destie, could you talk a little bit about how the law defines or thinks about small businesses and sort of practically how it impacts them and their workers?
Sure. And I also just wanted to follow up briefly on what James says around small businesses who want to be able to offer a benefit like this, but can't quite get there. As a nonprofit, we operate like a small business. Our organization does offer paid family and medical leave, but with no insurance backing to support that. And so there are so many employers like ours. And I think of, family-friendly, like women-fueled organizations. This is the foundational support to help organizations like ours and businesses like ours to get there. So the way it works in practice, or the way it will work in practice, is that in terms of the policy in general, it's a payroll contribution. So it's a small contribution from employers and a small contribution from employees. On each side, it's about 40 cents per $100. We'll get an actual number when we get farther into implementation, and that number will change each year, but it'll always be in the 40 to 50 cent sort of range on each side. But when it comes to small businesses and self-employed folks, they won't have to chip in the employer side. And so small businesses won't have that additional burden. That's organizations under 15 or self-employed folks won't have to chip in the worker side. So we're making sure that small businesses are supported both in having access to the program, but also not having to pay additionally for it. And then there are some additional pieces around for businesses. In the event that people take leave, employees take leave, but they have not been employed for more than 120 days, smaller businesses don't have to hold that position for them necessarily, although they can. So we've tried to make sure that we're acknowledging the burdens that small businesses face. One of the things that I think we've heard a lot from smaller businesses is they're worried that people will take leave. And they're having a hard time keeping folks, employed. Like we're really in a challenge right now around hiring. And I think the conversation we have with them is to say, we know people are taking the leave anyway. We know people are having babies anyway. We know people are getting into car accidents anyway. And we know, because businesses say that their employees are like their families, we know that we want to support our families in being able to take that leave without facing economic crisis. And so we don't think that this is going to, undermine the stability of small businesses, because we know that folks are already engaged in their regular lives, and that means taking time away from work.
Thank you, Destie. And I think we want to take a little bit of a bigger picture right now in terms of sort of how we got here, both how this conversation has been playing out across the United States and in other parts of our country, and also how we got here in Maine. So James, I think I'm going to go to you first to maybe give us a little bit of that national perspective. And because other states have enacted these policies and had them for a while, there is good evidence for their impact, including some evidence that businesses are benefiting and glad that they have the policy once it's in place. So James, why don't I go to you first?
Yeah, thanks, Megan. So As some of you may know, because I think is a startling statistic that is fairly widely cited, but the United States is currently the only high-income country that doesn't provide paid family medical leave on a national level. There are even, dozens and dozens of countries across the income spectrum that have some kind of paid family leave program. And the United States is one of the only ones that doesn't, and certainly the only high income country that doesn't. That's meant we have seen some efforts to put in a federal program in place, but they've kind of been stalled in some of the congressional gridlock. So that means that we've seen states take on a lot more of that responsibility. We already mentioned that there are 13 states plus the District of Columbia have a comprehensive program on the books. Some of them are still getting up and running. We saw Minnesota be a state that passed a law this year just before Maine did. And that includes 3 states in New England that already have comprehensive statewide programs: Massachusetts, Rhode Island, and Connecticut. And the Rhode Island program in particular is one of the longer lasting ones as well. So those have been really handy to give us some perspective on how this program is working in other states. Our program is modeled pretty closely on what other states have been doing. They're all structured in some similar ways as a social insurance program. So as Destie mentioned, kind of having a payroll contribution. In our case, it's split equally between employers and employees. It'll come out of people's paychecks every week or every 2 weeks, every month, however you get paid. For most folks, it'll work out to about the price of a cup of coffee a week, about $2 to $3 a week, but it will depend on it scales depending on how much you earn. And people are typically entitled to 12 to 16 weeks of leave. There's usually broad eligibility and near universal access to the program in states. So Maine follows a lot of those different themes as well.
And how many weeks in Maine, James?
The Maine program will offer 12 weeks of leave.
And there's good evidence out of California in particular, I think, in terms of businesses really liking the program and seeing retention of employees and having a positive review after it's been in place for a number of years.
Mm-hmm. Yeah, often we see those benefits. Kind of people and businesses really appreciate those benefits more after the program has been in place as well, and the uncertainty is going to weigh a little bit.
So Destie, I'm going to go to you to talk a little bit about what it takes to get this kind of policy done in Maine in a state government. And as you mentioned, the Maine Women's Lobby is a small organization. MECEP is a small organization. So maybe you could give us a little bit of a peek behind the scenes of how it all comes together to enact something that's going to affect, hundreds of thousands of people and workers across the state.
Sure. This for me is the fun part. I love the sort of strategy and chess game of how you do this. Although I think even this is such a significant policy, both in terms of the policy and the startup funds, such a significant change to our employment system that I think you never believe it's really going to happen until the last minute. But we do know that it really was the culmination of years and years and years of work. So Maine actually was on the front lines of family and medical leave, unpaid family and medical leave. We passed in the early 90s, in part through the leadership of the Maine Women's Lobby and other partners, one of the first, I believe the first state level unpaid family and medical leave in the country. So a couple of years before the federal FMLA was passed. And so that has been part of our bread and butter in Maine and at the Women's Lobby for decades, particularly for us because of, as I talked about, the way we understand that the lack of this kind of infrastructure is so key to pay inequity and higher rates of poverty that women experience over the lifetime and in retirement. So I would say, we started decades ago. The more recent push, I would say in the last 5 years, has really been to build out the coalition and build incremental steps toward this, because you don't pass a huge policy with $25 million in startup funds in one go. it just doesn't, it's not very effective. So the current iteration of the coalition started in 2019. There had always been partners at the table, but in 2019, we sort of formalized it, made it official, gave it a name, started having regular meetings. And that is also at the time that we began the working toward creating a commission instead of trying to pass the law. So what I would say, one of the key reasons that this did pass is because we had a strong, vibrant, robust coalition. We had 40 organizations where everyone was contributing the best of what they could bring to the table. If you were a storytelling organization, that's what you brought. If you could do paid digital, that's what you brought. If you could answer Friday night calls about what wage replacement would look like in practice, thanks, James, like that's what you did. And so every partner was seen and honored for what they could do. And we really capitalized on all of those different skills. That did not start in 2019. It took a long time to get there. But the other piece of it was that incremental approach. So not trying to get the huge thing over the line at once, but to help create a commission. The minute that bill passed to create a commission, we started in our coalition saying, who should sit in those seats? How should this work? What information do they need? What national technical partners, technical assistance partners should they be connected with? What do we hope they hear? And we began working with that commission to build that out and to make sure that the commission was putting forward the best possible report. And then working alongside them as partners in the effort so that not only did we get the best report that we hoped to see and supporting that, but creating a sensation of inevitability, a sensation of incremental work where we would come into this session with a feeling of like bipartisan, unanimous agreement. Things might not have ended with the, arm in arm, marching in hand, bipartisan unanimous agreement we hoped, but we certainly came into the session with that. And that creates a sense of power, a sense of agency, of expectation. And so we had the good policy, the buy-in, the coalition, and the public expectation. And those were the pieces that helped make it possible. We had that outside game, and inside we had deep trust and knowledge and connection with partners and sponsors. And I would say those sponsors were not only Senator Daughtry and Representative Cloutier and their staff, but also the chairs of the Labor Committee, Senator Tipping and Representative Rader, the House and Senate majority leadership, Mo Terry, President Jackson, Representative Speaker Talbot Ross, like a lot of people understood and cared about this. The Appropriations Committee, members of the Appropriations Committee, all navigating toward an ultimate opportunity to get this over the line.
Thanks, Destie. James, do you want to add to that? Maybe what you were doing late on Friday nights?
Yeah. I think Destie really nailed it in terms of like it being such a group effort and getting a lot of people together. I think we worked, I think having the combination of collecting signatures for the ballot initiative was helpful as well, showed a real public widespread support for the issue. But in terms of kind of like some of the stuff that I was doing, I think, my role especially was, as Destie mentioned, kind of some of the cost modeling, trying to figure out kind of if we tweak the policy in this way, how much extra does that cost? How much does that mean people are paying? Trying to design a policy that and this was one of the things that we really focused on as a coalition and came together as an agreement to, is a policy that would work for low-income wage workers particularly. We'd seen in other states, California most notably had a program that had a very low wage replacement or relatively low wage replacement rate. I think it was about 2/3 of your wages for all workers initially. And there was a lot of good research to show that that just wasn't working for a lot of folks. It led to a lower take-up rate than they expected. And that was mostly low-income workers, because if you're working minimum wage, you can't afford to take time off from work if you're getting 2/3 of minimum wage back. So the coalition, we were all really united, I think, on making sure that that wage replacement rate for the lowest income workers was as good as possible. And we ended up with a policy where the lowest wage workers will get 90% of their wages back, which I think is a really great outcome. And yeah, so that was one of the goals. We were also just trying to make sure that we could balance making the policy as pushing for it to be as robust as possible, while also keeping the costs manageable, not pushing too high of a payroll tax on folks. And also just seeing like what had worked in other states, what lessons we could learn from them, and that sort of thing. So a few different kind of policy related areas there.
And I would say too, to pick up on some of those threads, James, that some of the back end strategy that was probably maybe less visible to the public, or people, might have had questions about how the interplay actually worked in practice. That those coalition bottom lines were essential in knowing that we were united in the strongest possible policy, and that none of our membership was going to negotiate away key elements, which is something that has happened in other states. So we absolutely protected against that because of the trust that I think we built, trust and systems. And then the other piece of the back end strategy was the ballot initiative, which you mentioned. I think people heard a lot about the ballot, but might not have understood what the long game was there. And so 16 months ago, long before we came into this session, two of our coalition partners, Maine People's Alliance and Maine Women's Lobby, joined together to file papers for the ballot initiative. We got 80,000 signatures in partnership with lots of the other coalition folks, but we did try to keep it kind of separate so that the coalition itself could just focus on legislation and the best possible approach. But we always knew we had that ballot initiative waiting in the wings as a backstop. It's all well and good to have coalition bottom lines, but when it comes down to it, if you know you're going to get something or nothing, it's really hard to stick to your guns on a progressive policy. What the ballot did was both create this sense of impending doom, I guess some legislators would say, but the sense of it is now or never. You need to do something, because if you don't, we will. They knew that we were going to go to ballot. But it also created an ability for us to say, oh no, we are not going to a 70% wage replacement. We simply won't do it. I mean, I guess I would say I think that's kind of a racist policy, because the people that leaves behind are low wage workers, people of color, women. We were able to say that in comfort, knowing that we would have another option, a plan B. And so the ballot was a really critical piece of our work.
Definitely. We're going to go into kind of what comes next, because this isn't, passing the law is not the end of the effort. And we're going to go to questions in a few minutes. So if you have any questions, please go ahead and drop them in the chat and we will get to them. But at the moment, let's talk a little bit about what the next steps are in terms of rolling out a pay leave program and actually implementing the law. It's 2023. James referenced 2026 as a key year. Destie, what comes next?
So just like when we helped pass the bill to create the commission, the work first begins in thinking about how the rulemaking will happen. We've got 2 years of planning and implementation between now and when this is a fully fledged program existing in our state. And so we want to be at the front of the table from the beginning. And so Department of Labor has already begun talking in public about their rulemaking process. They'll begin that this fall. But a key part of this work is that there will be an oversight committee. It's the authority, is what it's called in the law. That authority will be a group of citizens and experts and representatives from different parts of the government. We, hope that that authority has is sort of well representative of our community, has the perspectives that we know need to be in there. So we're beginning the process of thinking about what Department of Labor needs to hear and consider as they move forward with their rulemaking. Some of this work is all like behind the scenes, but it's so important in how the law takes shape. And we also have our eyes on some of the parts of the policy that we did not like in the first round, and that we know there are still opportunities to change. The biggest of which I would flag is that the law has the option to have the administration of this program be run by a private company. There are lots of reasons why that isn't necessarily a great outcome for Maine. We know that privately administered programs tend to cost more, and people, more claims are denied. We really hope that this is a publicly administered program for and by the people of Maine and the state of Maine and state entities. And that's certainly something that we'll be working toward beginning essentially, I would say immediately, except we all need to just sleep for the next 3 weeks, but September.
James, do you want to add to that?
Yeah, I mean, I think for a couple of like definite dates on the timeline, we know that the rulemaking is supposed to be done by January 1st, 2025, but we think they'll be a little faster than that in terms of at least getting started. But the contributions to the programs, the payroll taxes will start on January 1st, 2025, and then people will be able to take leave starting on May 1st, 2026. And that's to make sure that the fund has enough reserves in it. We need a year of paying into, or a little bit over a year of paying into the fund so that there's money there for people to take leave, and there's triggers in the law to make sure that it's solvent and that sort of thing. Some of the work will be in terms of determining exactly what the final rate is going to be. We have a pretty good idea of what that the rate is probably going to be in the region of 0.85%, but we'll see. We'll get professional actuaries to give an official estimate of that. And I think sort of in terms of the rulemaking, I think one thing we did when we were drafting the law was try and, if you look, it's fairly detailed. So there aren't a lot of things that are necessarily left up to interpretation, which was kind of a deliberate choice to kind of make it fairly tight in terms of a law. But there are some things, some terms that aren't sort of like strictly defined in terms of one thing, for example, is when you're scheduling leave, you're supposed to schedule leave to, unless it's an emergency, to avoid hardship to an employer. And so sort of the definition of what the Department of Labor takes as that hardship and how employers can prove that will be important, to make sure it doesn't give too much leeway, I think, to employers to deny access to leave or make it inconvenient to schedule. And then the other thing we're watching is going to be we already know that some of the business groups, the Hospitality Association and the Retail Association, I think in particular, have been talking about petitioning to make changes in the law that we just passed, and to try and undermine it immediately. So certainly I think in the next year and the year afterwards, there will be sort of a need to work with legislators to kind of push back on any attempts to make changes to the law before it's even really come into effect. So
thanks, James. And how is public pressure or a role for interested individuals? What are the places that people can help or take action at this moment, at this point in the process? Destie?
I think right now it's important for people to know that implementation is also hard work and really important for what the program actually looks like in its day-to-day operation. I think that when you have a huge, win like this, when something big and bold happens, people think, oh, thank goodness we did the thing, we checked the box. And so I want people not to be surprised when we keep coming back again and again in October and saying, oh, here we go, we're starting rulemaking. Oh, it's time for a public comment period. That we want people to understand, people who care about this issue, who are excited about it, to know that there is still hard work ahead of us, not to be demoralized, but to recognize that this is part of the arc of building out big programs. And so don't be surprised, be excited. And don't be worried, because we're still in the game and we're still have our eyes on the ball, and you'll still be hearing from us. But there will be work for folks, to stay connected. It begins by thanking legislators who supported this big, bold program and this big, bold budget. I think we have dropped in here a link for you to reach out directly to thank your legislator if they supported this bill, the budget. So it starts with that. It starts with continuing to keep our eye on the ball in following along with paid leave updates with the work of the coalition. You can follow us on Facebook. You can follow us on our website. We'll drop those links in. And continue to pay attention to the places in your life where paid leave matters, would make a difference, where it provides value, because those stories are still going to matter when we move through this implementation process.
James?
Yeah, I mean, I think that, I think that's right, that sense of needing folks to sort of, stay engaged, don't necessarily be demoralized that there's more work to do, just see it as kind of like continuing to build on the work that we've been doing. I think there'll be opportunities for public comment in rulemaking. Once that gets underway, there's always a public comment period, so that'll be a chance for folks to engage. There may be testimony on bills if we see attempts to undermine the law that people can submit public comment on. So I think certainly staying engaged with MECEP and the Maine Women's Lobby. Will be sending out kind of alerts as those go out, and folks will have a chance to share their story. I think the idea of thanking legislators is really good and important too, letting them know that, folks really appreciate this new law and what a difference it's going to make to kind of continue their feeling of accomplishment in that. And I think also kind of getting at what Destie said at the end there is sort of, letting other folks and people in your life know that paid family medical leave is going to be available to folks to take from 2026, so that people will be aware of their new rights in the workplace and their new ability to take that. And it's something they can look forward to.
I think one thing you both touched on really well is that our organizations, our partner organizations in the coalition follow this really closely. And one of our jobs is letting the public and public support know when are the key moments to weigh in, and that we will definitely continue to do that. So we do have one question from the audience. That's where we're going to go now. If people have others, please go ahead and drop them in the chat. This is from Nadia. Where is the money coming from to pay for the startup costs to start this program? Do you anticipate a lot of openings for DOL positions or advocacy positions to help implement this program? Someone want to jump in there?
I can start, and then Destie might have some other thoughts. Yeah, I mean, so the budget included, and this was one of the things that was really important, and one of the reasons why I ended up in the budget, is that the budget includes about $25 million over the next couple of years to implement the program, and the startup costs for it. So that includes costs for some new technology pieces at the Department of Labor, also a small staff to begin setting up the program. There may be additional staffing needs as we get further in, like in the next budget cycle, and some of that will come from the payroll tax for the program includes the administrative cost of the program, so it'll include the cost of potentially paying claims and that sort of thing, or for paying for a third-party administrator, depending on what route the department goes down. So that is built into the fund. The initial ongoing staffing is relatively small. I think it's about half a dozen positions or something like that. But that is all built into the program, and it essentially came from the extra surplus funding that they had this year.
I'm going to go ahead and ask the next question and then go to Destie. And Destie, if you want to touch on both, that's great. So this is from Mark, wondering if part-time and adjunct faculty at public universities and community colleges will be eligible as covered individuals. This is a large and important group of represented employees.
Thanks for that question, Mark. And it is an absolutely important and a great example of the kinds of positions that we understand are generally underpaid and undervalued, and yet bringing huge value to our communities and who we want to make sure are covered. The way this will work is that if you make I want to make sure I get this right, and James, you'll correct me if I have not. But you have to make a certain amount of money in the prior 4 quarters or 5 quarters of the year in order to be eligible to pull down benefits. So it's about 6 times the average weekly wage. In Maine right now, that's about $1,000. So once you make $6,000 in any kind of employment over the course of 4 quarters, I think, then you are eligible for the program, whatever job type you have. Self-employed folks are slightly different. Those you have to opt in. But I think I would read adjunct faculty. You are getting paid by an employer. Once you cross the threshold, you're in the program. I think that's the fastest and quickest answer to your question. James, you may want to add more.
Yeah, I think that's right. I think you got it. And that amount that you'll have to earn each year will change because it's pegged to the statewide average weekly wage. But it's set to be about the same as the unemployment insurance program. As I said, it covers 90% of workers, so it's supposed to be as inclusive as possible, while ensuring that folks have, some version of some skin in the game for it. And I think one of the things that may come out or will be part of the rulemaking process, perhaps, will be determining exactly some of the definitions of employee versus self-employed there. I would imagine the adjunct faculty would fall under regular employees, but one of the things that was important for us in the program was to give self-employed people the chance to opt in. So even if by some chance your employer designates you as a contract worker and somehow not covered as a regular employee, you'll have the chance to opt into the program. And the cost would be the same to you as it would be as if you were an employee. So we're trying to cover as many people as possible.
We got a couple more questions. I'm going to throw them both out there, and we may go 1 or 2 minutes past, but trying to end pretty close to on time. So from Rachel, do we expect the opposition will fight to remove the health insurance coverage section of the paid family leave insurance program? And then from Emily, are H-2A and H-2B temporary foreign workers in agriculture and other industries eligible once they meet the income threshold? These are pretty specific, so might have to get back, but James or Destie?
My quick answers are, I don't know, no certain industry or type of worker is categorically excluded from this. And then in terms of, do we expect the opposition? I think we expect the opposition to attempt to chip away at as many parts of this as they can. And so whether it's trying to peel off health insurance or create certain exemptions, or to change the wage replacement or the allowable categories, I think the answer is probably yes. And that's why it's so important for us to make sure that we continue to maintain a strong coalition and a strong connection to community members who care about this issue over the long term.
Thank you, Destie. So I do just want to highlight, and thank you all for the questions. I want to just for a moment highlight again why this matters so much. Right now, there are workers who have a serious illness or an injury, and they go back to work before they're fully healed because they can't afford to take any time off of work. There are people who are leaving their jobs because they have to care for a family member, a loved one, and they can't, their job won't let them take the leave that's necessary. There are people who are having babies who are going back to work after 2 weeks, 4 weeks, 6 weeks, because they cannot afford to take that time off. And that is going to change in Maine. And for people who are on this call who are supporters or donors to MESEP or to the Maine Women's Lobby, for people who may have been gathering signatures or who signed a ballot signature form, for people who testified or participated in the commission or weighed in with a lawmaker, this was a huge effort. And I just want to highlight why it's both so important, and a huge thank you to everyone who supported it along the way. And there's definitely more work to do, as we talked about here. So there is contact info for our speakers that's in the chat. Please reach out if you have more questions. We did record today's event and we will share that out. I hope you will also, I want to extend an invite and hope you all will join us on September 20th at USM in Portland. The MECEP Policy Insights talk is going to be with Chris Smalls, who's the founder and president of the Amazon Labor Union, as we continue this conversation about what a worker-friendly economy looks like and the importance of worker power in it. Thank you all so much for joining us today.
Thank you so
Thanks,
much.
Megan.